Welcome everyone to this Yas Cast. It's a podcast from Yas Clinic, Khalifa City in partnership with Abu Dhabi Stem Cell Center. My name is Dr. Amir Sadawi. I'm consultant hematologist. So throughout the month of Ramadan, we are bringing you a series of medical conversations discussing medical topics that might be interesting to you and your families. And we'll try to shed light on these topics in a simple and relatable way. So in each episode, I will sit down with a leading physician from Yas Clinic who will share trusted knowledge and information that help us to understand these topics in a simple way. Today's episode, we'll be talking about terms or topics or services that are becoming increasingly common in the medical practice. What I mean is that we'll talk about terms like regenerative medicine, longevity, or well-being or well-being medicine. So now all these terms talking about living longer is not only living longer, living better as well, and these different approaches talking about how to maintain our health, preserve our energy, or even improve our quality of life. So to tackle these issues and these terms, I'm happy to have with me our guest is Dr. Amir Fazil. Dr. Amir Fazil, he's a consultant family medicine and he's also the clinical lead for the regenerative medicine at Yas Clinic, Khalifa City. Dr. Fazil, if we talk about these terms, that regenerative medicine or longevity, it might not be very easy to understand for someone without a medical background. How can you, in a simple way, explain these terms to exactly someone without medical background?
Thank you very much, Dr. Amir. It's an honor for me to share a platform in your presence. We learn from you and we look up to you. This is a very important question. I'm a family medicine consultant, so my background allows me to focus on preventive health. But regenerative medicine is an up-and-coming field of medicine. A simple definition is that it's a field of medicine in which we use the body's own healing capacity to support various diseases. And we are just not focusing on treating the symptoms. We are focusing on reducing the inflammation in the body. We want to preserve the function, and we want to create an environment of healing, because healing elements are present within the body. So this field of medicine is focusing on the body's own ability to heal. Saying that, in Yas Clinic, I found that it's a privilege to work in such a prestigious organization, because the focus of the organization is to have integrated care. So we have tier 1 consultants from all over the world, and as I lead the regenerative medicine, we have a GMP lab, which is ADSCC. It's an internationally accredited stem cell lab. And each consultant, for example, orthopedic, dermatology, so they are using regenerative medicine in their own field. And it's unique that the field expert is treating the patient. That's the regenerative medicine definition. From longevity, as you rightly mentioned, there is a difference between lifespan and health span.
So is it live longer, live healthier, or both? Or
live longer is already happening within the last few decades due to health infrastructure, better quality of life. Humans are living longer. I'll just give you a number. So by 2050, the number of patients living more than 60 years will double to 2.1 billion people across the world. So living longer is happening in general at population scale, but living better is where we focus on health span, living well. And that's where the focus of regenerative medicine is, in this area. And this is the priority for UAE government as well, to increase the health span of its population. On average, we lose around 8 to 10 years in poor health. So most individuals, generally, the data says that they spend 8 to 10 years in poor health. So our focus is to compress that window and increase health span and make ourselves more independent, more productive, and more happy. All years of life are critical, but when those end of last 2 decades is where the disease comes in, and that causes a lot of physical and mental burden, not just on ourselves but on our families as well.
Okay.
So the focus is on living well, and then if you live well, the lifespan we expect to increase anyways.
Okay, very interesting. So Dr. Amir, as a family medicine, from your practice, from your observation, do you notice a shift in the patient priorities, towards more prevention, early detection, rather than just seeking to treat illnesses in general? And do you see this shift, and does it have impact on your practice in general?
Yes, the health dynamics have been changing throughout, and you would have noted in your career and your specialty as well. Family medicine is a broad specialty. Exposure to working in England and Australia, so working in two different continents gave me an exposure. Even the overall, of course, the disease mix is the same, but approach in the healthcare systems, the way the healthcare systems are designed are different. UAE is a progressive country. As you know about Emirati Genome Project is one of the unique projects in the world that, whole genomic sequence data is kept for the population. And that is a very powerful tool and can have a huge impact in patients' life. We all know that AI is there and it's going to be part of everyone's life, and how patients access health information and how patients can use it in their benefit, for example, diet-based advice or journal advice, and then the risk associated with it, whereas AI will have its limitation and can cause distress to the patient. For example, your hematology patient can search some blood result which may include a risk of malignancy in the books, but when they see the physician, that risk will not be there. So it's important to understand the role of physicians is always going to be there, and field experts. But I agree with you, the approach, people have more access to information, sometimes wrong information through social media, and then information has to be personalized, so each individual has different health risks. For example, someone has a family history of some condition, they may need screening or seeing a physician much more before maybe if some layperson is saying something in the media. We have seen the controversies around statins and the how media affects population behavior and their perception towards medication. So it's a very important area. I think UAE population in general, I see more and more the approach is towards weight loss, living healthier, longevity is in the focus of lots of our patients who come in for stem cells. I think people are moving towards healthier lifestyle, and I expect that there will be positive impact of having more information, as long as we make sure that the negative aspects are covered.
So if one of our listeners, maybe they're in their late 40s or late 50s, and then they want to start now in a health maintenance program, so how do they start? What are the practical tips in that sense?
Okay. In regenerative medicine, there is an interesting concept of aging. When a baby is born and the life starts, the aging starts, as we know that. When I was introduced to this field, there was something fascinating. There is a very rare condition in which a surgery happens while the baby is in the womb. This is one of the cardiac conditions. But what the scientists noted, that after the surgery, the babies, when they were born, they never had any scar. And one of the reasons behind that was that the regenerative potential, the number of stem cells and the growth environment in a baby is at its peak. And as we grow older, the reserve of stem cells decline due to environmental decay. Of course, genetics plays a big role, and we can talk about it in the longevity section. At every age group, there are things that the patient should be aware of. The focus on healthy living can be done at any age. The answer is now, if someone is thinking about what they can do. So, for example, there are certain conditions that are linked with young men. As I said already, that if there is a family history of breast cancer, some women need to check genetic tests and go for screening earlier. Of course, they need to speak to their doctors. In the standard of medicine, which we proudly follow at Yas Clinic, we recommend that we follow the Department of Health recommendation on screening. For example, breast screening starts around 40. So, and lots of patients, they miss it. So we recommend, and we want to use this platform to remind them. Same goes for a Borath test that's looking for hidden blood in the stools. And that's a very powerful test, because some patients assume that if they can't see any blood, there's nothing there. But as you know, that's not the case.
This topic close to your heart as a family medicine, that patients should take their health seriously. Maybe they tell you, I'm healthy, I don't want to go to the doctor, I don't have any symptoms. How you justify this? How you convince these people to maybe some of our listeners to go and do these, especially in these milestones, as you mentioned, whether it's the breast screening or the stool screening or other tests that for early detection?
So I think I think it's more than the science. It's an area of logic that if you pick up disease early, there is a high chance that we can reach a cure. And once we reach a cure, we can avoid a lifelong disability. We focus in the screening, we focus on cancers, but then even diabetes can be prevented. Of course, it's a lifestyle. Type 2 diabetes is a lifestyle condition, but it can be prevented if patients can have early telltale signs. And one of the things I wanted to discuss is that before the disease comes in and before the focus in preventive health and regenerative medicine is proactive. So we look for insulin resistance, we look for pre-diabetes, and we change the lifestyle to have a positive impact. So we don't want the patient to become diabetic. And I think I see a lot of pre-diabetes in my practice here. And I think that the burden of type 2 diabetes is ever progressing. We are trying to make sure that, for example, a 40-year-old in the UK and in the UAE as well should have an annual health check done. If someone has a cardiac history, for example, early heart attack in the family, to put it simply, they should get their cholesterol checked. As I said, there is a condition called familial hypercholesterolemia, and I've seen a couple of patients who were not taking medications, and we use the Emirati Genome Project, and this is a huge benefit to the population here, that they can access those genomic data to confirm the diagnosis. And these days there are newer treatments, as you know, there are injectables to treat the high cholesterol, and we can prevent stroke, the jalta, and we can prevent heart disease quite powerfully if the interventions are started early. So each person is different, but then that's the national screening, international screening standards should be followed. One of the things is that patients are sent reminders. And it's important for healthcare systems, and with the AI integration, which we are doing, we are one of the pioneers in integrating AI in our systems, that the patient should be reminded in time. We are busy in life and we can miss appointments, but I think technology can be used that the patient adhere to their screening. And I think there is a demand requirement as well that the patients should undergo those tests to maintain their eligibility.
But I mean, from your description, I just feel that all these like longevity, the well-being, prevention, detection, these are interlinked together. I mean, they are not like different discipline, right?
Absolutely, it's on the point. We focus on the patient as a whole. When a patient comes in, and often because we are a premier stem cell clinic as well, and the patients would come in and they would expect that a single stem cell treatment will resolve all their problems. But we have a holistic integrated approach. So we first go through screening, we see what their existing health conditions are. Women above 50 and men above 65, we often pick up osteoporosis, and which the patient's not aware, and they come with joint pains. And as you know, if these patients are not picked up in time, if they fall in later age, they can develop fractures, which can be really detrimental to their life. So we have a fully integrated approach. And then this is what the standard of medicine is. But if I go into my specialty, what we do at Yas Clinic, we have a Marathi clinical leadership, and the purpose is to have most innovative and cutting edge technologies available as a tool to use. For example, we do nutrigenomics, which is a study of your patient's genome, gene data, to see which food is suitable to them,
diet,
and how can they use a personalized nutritional plan, and also the supplements, because sometimes they need supplements based on their genomic
So you
results.
use nutrigenomic now in your clinic for primary care plan for our patients?
Absolutely, and we have a dietitian who specializes in this area. So because this is a niche area where you have to have a skill set to understand the nutrigenomic data. Same goes for pharmacogenomics, and it's again, I would appreciate, is one of the big, huge initiative in this country, that in Abu Dhabi, the pharmacogenomic data for those patients who participated in Emirati Genome Project is now available to them. I don't know the exact details, but if the patient is on multiple medications, then sometimes these medications are not effective, and we have to look at the gene data to see which medicine will be suitable to them. So often we pick up that some of the medications are not highly effective, or putting the patient at risk of side effects based on their genomic makeup. So we are going in depth into their care when we look into the genomics. Adding that, we also have the ability to look at the areas where there's a lot of research going on. When we talk about longevity, for example, telomere length. So we have a program in which we are using stem cells to look at how it's affecting the aging at cellular level. So for the audience, telomeres are the part of the DNAs which help repair the DNA, and these are the caps on the DNA. So if there is a damage to the body, the length of the telomere becomes small. So the scientific community thinks that if the length is becoming smaller quickly, we are aging quickly, so there's a decay in the body. There is reasonable evidence that lifestyle does increase the length of telomere, but any intervention that can help reduce the stress at cell level would either maintain the length of the telomere or increase it. So there is a lot of research around longevity.
There is an evidence base that like lifestyle changes are actually like important longevity measures.
Absolutely. So if I put a figure for our audience is that because often people think, what is the portion of genetics? What is the portion of lifestyle? So I was looking at the evidence, and it's quite interesting. 20 to 30% in one big study, and it's attributable to genetics. So it's non-modifiable. So those things can trigger on, and we can't change them. At the moment, there's a lot of genetic research going on, and maybe in 20 years, these can be. But at this point, the 20 to 30% of longevity, aging or disease is linked with the genomics of the patient.
Okay.
80% is modifiable by lifestyle.
So is it only lifestyle, or there are other intervention might modify that? Any procedures or any
absolutely
specific treatments? Or
yes, so the most powerful is the lifestyle, but then the advanced treatments that we have can help slow down or reverse the damage that has occurred. For example, the mesenchymal stem cells, which is extracted from the umbilical cord, these cells are known to reduce inflammation and improve the patient's immunity. They modulate the immune system. So there are studies that suggest that they can be helpful in managing a few conditions. Of course, this is an area where evidence is developing, and us being a tertiary care center, a highly specialized unit, we have those cells available, and there are selection of patients. We select patients very carefully. We are observing this data as well as we move on. So not just the stem cells. So our hospital has a hyperbaric oxygen therapy unit. And hyperbaric oxygen is a fascinating treatment. It has been there for 100 years, and it was used for injuries secondary to deep sea diving. But over the years, there is so much evidence that's coming up, and that a hyperbaric oxygen chamber, when the stem cells were observed after 10 to 20 sessions in the chamber, so the stem cells were found to be increased by 3 times, so 300% in the peripheral blood. This type of treatment is normally used to treat non-healing bones and chronic infections and and non-healing wounds, but those are it is used as a standard of care treatment modality when other treatments have failed. Even some of the cases, and I must be very clear, very few cases will be even approved by the authorities that they can be treated. But we are using this in regenerative medicine for its regenerative effects. So we are combining, so it can help improve patients' symptoms in chronic fatigue and help patients with chronic tendon injuries. So we are actually monitoring those outcomes as well. There are actually some supplements which are linked with improving the patient's metabolic function, so those can be used as well. And in general, we combine everything, so from deep assessment of the patient, applying the standard of care which is actually established science, and then we use regenerative medicine as a tool in some patients to improve their healing effect. Sorry, it was a long answer, but it's an integrated 360-degree care, where regenerative medicine is part of the solution. It is not the main solution.
Okay. So then the other term, maybe it's good just to tackle it. There is the well-being or wellness. There are wellness program or wellness centers for medical centers. So is it there is an overlap, of course, between these? Is it also focused on habits and lifestyle changes? And maybe you can elaborate on that as well.
We pride ourselves with our integrity. So when it comes to wellness, of course, the advanced treatments will help. But I want to just highlight a few facts that, mindfulness is key, because how we define health is mental and physical well-being. So I was studying that 8 weeks of mindfulness can actually has been found to reduce an inflammatory marker in the blood called interleukin 6. So I was surprised as a physician to read that study. Of course, it's a small study and these things need to be explored further. But meditation, mindfulness is key. Maintaining muscle mass is actually linked, and it's been proven to link with quality of life. If people maintain muscles after 50, their health span is observed to be increased by 3 years, which is, I think, very significant. After 50, every year, people tend to lose 1 to 2% of their muscle mass. So they need to make sure they're having adequate protein and resistance training. So resistance training twice a week is linked with improving longevity, and that's also been documented in the study. So this is not a theory, it's like, there is evidence behind it.
So if you feel that you are losing energy like fast, aging fast, you shouldn't accept it. Maybe you should get like some guidance and advice from an expert like you.
So we are still learning. We have a team, and I'm privileged to be part of the team. But yes, we will encourage. My personal experience in UAE is that we commonly see vitamin D deficiency, iron deficiency. I've worked in this country now for 3 years, and we do try to do research on what we are doing. And vitamin D deficiency is linked with a lot of things, much more than what commonly people know. So in regenerative medicine, we want the vitamins to be close to the upper limit of normal. Vitamin D is linked, can be protective from cancer, of course, with other things. Vitamin D helps with immunity. Vitamin D not just helps with the focus and energy. It's when the DNA is damaged, vitamin D is used to repair it. So for us, vitamin D is different than maybe physicians working in different specialties. Same as you mentioned, we are assessing each patient as a whole, and if they need any expert input, we don't shy away. We have got all the consultants, and we always take advice, and we respect the field experts because we are still family physicians and we understand our limitations. So then the best way is that the patient get a multidisciplinary team care, and then we are very clear about what interventions they can use for their well-being. But we always make sure the patient understands the powerful impact of lifestyle change, which is the most impactful if they want to live healthier.
Yeah, very nice. I mean, ultimately, it's about adding health and quality and purpose to life, and investing in your health and body is definitely an investment for the future health. And so thank you so much, Dr. Amir, for explaining this important topics and shedding light on these terms and important topics to our listeners. And thank you for joining us in this episode. And see you soon in our next episode with the Yas Cast during Ramadan. Thank you.